Welcome. My name is Peter Strong. I'm a professional psychotherapist and I specialize in mindfulness therapy for overcoming anxiety and depression and addictions and other psychological problems that respond well to mindfulness therapy and mindfulness training in general. I work a great deal with anxiety and also with panic attacks. So I've developed a system for working with panic attacks that's called mindfulness-based cognitive therapy for panic attacks. So what is mindfulness-based cognitive therapy? Well, mindfulness, the first part, is a way of developing more conscious awareness of patterns of reactive thinking. Typically, our thoughts are reactive and habitual in nature. They get triggered by certain events, certain situations, certain experiences, and this happens automatically without our awareness. So mindfulness is a way of developing that awareness so we can see the thoughts that get triggered much faster and before they simply take hold and start to grow and proliferate. So mindfulness is about developing this skill of awareness of the activities of the mind. It's also about developing a conscious relationship with the mind, with the thoughts and with the emotions in the mind, that is characterized by being non-reactive. That is, that you can stay conscious with thoughts or with emotions without becoming overwhelmed by them, without becoming identified with them. So developing this non-reactive relationship is a very important part of mindfulness. So that's a little bit about mindfulness training. The cognitive therapy part simply means working with the thoughts that we become mindful of that seem to trigger our anxiety and our panic attacks. The way that we work with these thoughts is by first developing this conscious relationship, which essentially breaks the habit that feeds the anxiety-producing thoughts. If you can sit with that thought and not react, then you have neutralized that thought. So it's quite powerful. Just developing mindful consciousness itself is a very powerful way of breaking free from those habits that feed anxiety. But there are many other ways we can work with reactive thoughts. And one of the favorite ways that I like to teach is to work with the imagery of the anxiety or the panic attack itself. Most people have never actually looked at their anxiety or panic attacks. They don't know what they actually consist of. They don't know the structure of these very important parts of our mind, and that's something we develop during mindfulness therapy in general, is looking at the structure, investigating the structure of your anxiety. And the inner structure of anxiety is based on imagery. So we look at the imagery of our anxiety, and the more you learn about that structure, the more that you can change the structure. If you change the imagery of your anxiety, you will reduce its intensity considerably. or at least you can learn how to reduce the intensity of the anxiety by experimenting with changing the imagery. One classic method that we look at is to change the size of the imagery. Obviously, if the imagery is very large, then the anxiety will be very intense. So if we try to make that imagery smaller, then the anxiety will become less intense. There are many other features of anxiety imagery that we can play with and change, and this really promotes the resolution of the anxiety. It helps teach the anxiety how to resolve itself, how to break its habitual imagery and change to a imagery that does not produce the anxiety. So we might make it smaller, we might change the color of the image, we might change the position of the image, and so on. And these techniques are very, very effective indeed for anxiety, and also for depression too. I will teach you how to work with your anxiety attacks using these mindfulness-based cognitive therapy methods. I will teach you how to do this during our online therapy sessions together. And you can then practice these methods between sessions. You can develop a practice that will essentially neutralize those anxiety reactions. This approach is very effective, and most people see quite dramatic changes within the first few sessions. So this is a very different way of working with anxiety than you might be used to. It does not involve medications. Medications are not a suitable long-term strategy because they do not change those underlying habits that create the anxiety, that they are psychological in nature and require psychological interventions to change the anxiety, to heal it. Talk therapy can be useful, but is seldom really strong enough to actually diffuse that anxiety. Talking about your fear is not as powerful as changing the imagery of the fear. If you'd like to learn more about how to overcome your panic attacks and anxiety using mindfulness-based cognitive therapy, then please contact me. You can ask any questions you may have about how this approach could help you. When you feel ready, we can schedule a therapy session via Skype. I recommend Skype so that we can see each other. That is an important factor for increasing the effectiveness of our communication so that we can really develop these methods effectively. You need to be able to see each other. If you can see each other, then really Skype therapy is no different than meeting a therapist in person for the vast majority of cases. So if you'd like to get started with online therapy for your anxiety and panic attacks, please call me. Thank you.